So immediately last week, even before we had positive confirmation of the foot and mouth disease outbreak in the Hartenbos area in Mossel Bay, we actually established a perimeter control, a quarantine area, on a 10-kilometer radius around the, as they call it, the indicative farm, index farm. So on the index farm and around that area, we immediately established 5 visible or control points where we control all movement of animals in and out of the area, in assistance with the South African police and also the provincial traffic and local law enforcement agencies. So that has been in place since last week, Wednesday. We also then, with the assistance from our provincial disaster centre, requested province to come on board and to assist us with further control points, vehicle control points. An additional 4 vehicle control points was then established. So now we've already got 9 vehicle control points, and then roaming into the major routes by provincial and local traffic officials that now knows what must be and what permits the people must have, what the documentation is when you want to move animals, etc. So that was put in place immediately. So then from a coordination platform, we activated our joint operational center last week, and we now have meetings 3 times a week on Monday, Wednesday and Friday at 2 o'clock at this facility where we are now, and we try to get all the role players on board. For a day-to-day coordination, we've got a WhatsApp group. I think there's about 136 on there already, members, farmers, etc. So with the day-to-day operations, anything that gets reported is reported on the WhatsApp group, followed up and answers provided by the lady next to me, who is the state vet. And in that way, we try to coordinate and assist. So that was the initial response. Obviously, it's early days and there's a lot of work that needs to be done. I need also to mention, for some of the questions you're going to ask me, I'm going to say we're working on it. We never had foot and mouth in the Western Cape. So we're building the plane while we're flying it. We're learning from other provinces. We're trying to put the mark of excellence for the Western Cape on there and doing it good. It might be better. So let's see what we can do going from this point forward. And we have called for the following. So I'll start off by saying there's been a request for outside of the 10-kilometer quarantine area to put up disinfection points as part of the biosecurity measures from farms. We've asked for a protocol on that. So we've requested our provincial colleagues to give us a protocol that farmers can use. We don't want a lengthy procedure. We want a shortcut procedure to say, how can I put up a disinfection point? And what do I need to put there? And what must be there to make it legal? There's been requests for the closing of some roads in the quarantine area. Obviously, that is a process to be followed. You can't just cut off human movement. So there's a process to be followed for that as well. We said, if there's merits to it, we need to get a process to follow to do it, if it's merited and if there's an alternative route available, etc. So at this point in time, no legal closing of roads can be done. We're still waiting for a protocol on that. We've also requested for a protocol to be developed in terms of disposal of carcasses on the farm as well as off the farm at an abattoir, etc. FMD infected carcasses. So that's work in progress. We've also asked for assistance from vets, state vets, for private vets to assist our state veterinarians in terms of the providing of vaccinations, how they can go about to be allowed to work and assist our state vets. But the formal processes is started in that regard as well, and it's, as I'm saying, work in progress. So without further ado, I think I'm going to hand over to Dr. Leana to give an overview of where we are in terms of cases positive, cases being investigated, and the process going forward. Leana?
Okay. Yeah, I can start with the background. So last Saturday, we went to investigate. A private veterinarian had indicated that he saw some suspect signs on a dairy farm. And we went last Saturday and took some samples. It did look very suspect. What we saw was lesions in the mouths, on the hooves. They had reported a decrease in milk production, and there were sores on the teats as well, which to us seemed very indicative of foot and mouth disease. So we immediately then notified everyone to activate the processes so that we can get this contained. I must say I'm very grateful for the quick response that occurred over a weekend. It was then confirmed on Tuesday by the lab on the epithelial samples that it was foot-and-mouth disease. From our side, we're very fortunate in having a provincial director that is very motivated and got us some vaccine. We then got some of the OVR vaccine that Minister Steenhuisen had announced. We got 600 doses for the index farm, which we then vaccinated on Wednesday. We started from our State Veterinary George office to do the 3K radius inspections of the farms to see whether we see any lesions of spread of the virus in that area. We established the 10-kilometer quarantine area. So we started with the first 3 kilometers. We found lesions on the neighboring dairy farm, as well as another neighboring small holding. Those samples haven't had results yet. We are eagerly awaiting them. But we started preemptively vaccinating based on the lesions, those 2 farms as well. Further, we have been investigating epidemiologically linked farms, so that just means farms that animals move to or fro, or they share workers, share feed, share vehicles, so that we can follow up whether the disease has spread further. Over the weekend, we heard of another dairy farm in the 10K radius which was showing lesions. So our officials went on Saturday and vaccinated that farm as well as taking samples. So we will await that result. So thus far, we are awaiting the test results from those 3 farms with lesions, but they have been vaccinated so long. We try and vaccinate as quickly as possible to try and limit the clinical signs on that farm, as well as the virus that's excreted from the animals, so that you get a lower viral load in the environment and hopefully lower the transmission rate, so stop the spread as much as possible. Yeah, so that's where we stand at the moment. So yesterday afternoon, the farm's private veterinarian let me know that he saw 2 animals with some suspect lesions. It's a heifer farm with about 1,000 animals on that farm. It is obviously linked to other dairy farms, but it is the heifer farm, so the young animals. One of our officials went out today with a private vet, and they did vaccinate that herd and took samples there as well. So we will await those results. And yeah, they are actively, obviously that farm is now looking at all their other animals, whether they see anything in their other herds. So in terms of our legislation, the Animal Diseases Act, a private veterinarian can apply for authority in terms of the act to do certain functions on behalf of state. So, and they would need to present their application form to their local state veterinary office, who then recommends that person that they would like them to be able to do these functions in that area. And then that goes to the provincial director for recommendation, and that goes to the National Veterinary Services, who are the only ones who are authorized or are mandated to authorize people in terms of the act, and it would be for specific functions. So I think there would be 2 arms to that. The one would be in our outbreak situations, considering that we only have so many people in our office, and if we have been on a suspect farm, we stay away from other farms for 3 days so that we're not a way of spreading the disease. So our manpower is limited. So in that case, it would be that they assist the state veterinary office with the vaccinations on higher risk farms, with obviously state provided vaccine, etc. They would be doing it as if they were employed by state. Then there's another leg for the future once vaccine is more freely available, where they can assist farmers who want to voluntarily vaccinate. So they are not seen as a high risk, but they would like to vaccinate so long for in case. And then they would need to have a business plan on how that would work for the procurement of that vaccine and the surveillance that would be needed on those farms to show that they haven't gotten field strain infection, that they are only vaccinating. But that will obviously roll out as we have more vaccine freely available in the country. Yeah, so we have in our Department of Agriculture, we also have an agricultural support and development section. So fortunately, we have their support as well. They help us to just find out whose cattle it is and try and get contact details of the owners. In Mossel Bay Municipality, especially, they have a contractor, the Incident Working Group, which is also assisting us in various informal settlements and so on to get that information together, because it is quite a task to get all that information together so that we can contact them and organize a day to vaccinate. So it depends on the facilities you have. If you have good facilities, good crushers, good so that you can really pack your animals and go in quickly, then you can do 1,000 animal herd with 2 people vaccinating. You can finish it within a working day. It gets difficult if you don't have proper facilities, proper crushers, if the animals keep breaking out. So then it can take quite long. And so it depends very much on your facilities that you have available to work with the animals. My team has been amazing. They have worked round the clock on weekends. Whenever there's a need, they have been amazing to just respond and say, I will go. We have 2 state veterinary offices in the Garden Route area. It's the Oudtshoorn State Vet Office and the George State Vet Office. So it's us 2 state veterinarians. We have another state veterinarian who's actually at the export side, who is now assisting us as well in this crisis, as well as we have a ComServe veterinarian who is also now assisting us with this outbreak. And then we have our animal health technicians for the area. So we have our 6 animal health technicians in the George area, 4 from Oudtshoorn area, and we've also called in some help from our Beaufort West office as well as our Swellendam office, who are kindly loaning us some technicians so that we can work as quickly as we can. We've had rumors of when vaccine will be coming in and so forth. For now, in the Garden Route, our priority is to first work on the outbreak areas, make sure that we're not actively spreading virus from those areas. So we would like to go in there, go vaccinate there, and create a buffer. From there, our next area of priority is the communal and informal cattle, knowing that they would also not be employing a private veterinarian to assist with those functions. So that we will next be prioritizing those. It will be quite a job just thinking of especially the handling facilities, which we would need to provide and so on in those areas. And also just coordinating with everyone, because a lot of those people work during the week and are only available to present their animals on weekends. So it will be quite a process. Once we have enough resources after the outbreak has stabilized, we will then roll out to those areas. And hopefully by that time, there will be a system in place for the private veterinarians to assist their clients voluntarily, as well as enough vaccine to do that. So we're hoping that as the vaccine comes in, that a lot of the farms will be helped by their private veterinarians, and we can focus then on the communal and informal sector. So for now, once we had our index farm, our director procured us those 600 doses. I must say, quite quickly. I mean, we got the confirmation on Tuesday, and already we had the vaccine available for that. We then got another 5,000 doses last week, which is now finished. And this morning they provided us with another 5,000 doses, which we are planning to continue the 10-kilometer radius around the index farm during this week coming. And then we'll have to see about the new batches of vaccine that need to be imported. So what we received at the moment is the Botswana Vaccine Institute vaccine, which unfortunately it does not produce a long-acting immunity. So the protocol is that they get vaccinated, they need a booster about a month later, and then every 4 months they need to be boosted. So it is quite labor-intensive. So we're hoping that if we get some of the other vaccines, it might have a longer duration. So as far as I know, the OVR vaccines, so the locally manufactured, they, as far as I know, they have a very small capacity. So I think they are planning on doing, I think, about 20,000 doses, if I'm correct, a month. So it's not really that much. As far as I know, the ones we are looking at will be imported. I know there's two that are in question at the moment. It's the Biogenesis vaccine from Argentina and then the Dolvet vaccine from Turkey. So I'm not quite sure which one will reach us first. So I know Cape Nature has agreed to stop all permits at this stage for animal movements into the area. Wildlife movements per se don't fall under us. We only come in when there's a disease outbreak. But as far as I know, Cape Nature said they would be cancelling their movement permits into the area. At the moment, it doesn't seem that your normal antelope species and so on really play a role in the epidemiology of transmitting it. The one exception is buffalo. African buffalo do become carriers of the virus. And in the Western Cape, we only allow disease-free buffalo, which means they're free from foot-and-mouth disease and corridor disease and TB, as well as brucellosis. So they are disease-free buffalo, and obviously the people who own them want to keep them that way. And they are also a species that if you ever want to move African buffalo, they need to be tested for foot-and-mouth disease. So we know at the present, buffalo in Western Cape are free of foot-and-mouth disease. So yes, it will be quite difficult, but people who have buffalo, fortunately, the regulations state you're not allowed to have cattle on land that is registered for buffalo. So there shouldn't be contact between cattle and buffalo, which would protect the buffalo at this stage. But we do ask that everyone really focus on their biosecurity, as well as, especially if you have like lions and so on, now is not the time to bring in cattle carcasses onto your farm. I think there is a lot of fear. I must say the quarantine area where we've been working, the farmers have been amazing. They have been so friendly and complimentary, and I think that really boosts our officers' morale as well, to see that the people are appreciative of the efforts. So I must say I really take my hat off to those farmers, just still keeping positive and so on in these circumstances. I think the areas that are not affected yet, they are very scared of getting it, especially with the uncertainty of when the vaccine will be available, especially dairy animals, because they do get the worst symptoms, and getting a mastitis in a cow, you can end its whole production for, basically you end up with cattle which you have to cull. So for the dairy farmers, I think this is a major threat. I think for everyone it's a threat, but especially for the dairy farmers. So I think there is a lot of fear around that, and also because there's not a lot of control. I mean, they can't always control who's on the public roads and all of those things. So I think this is the beginning stages. Once we have the vaccine available and we have our rollout in the communal areas and so on, I think that will also help to just alleviate that emergency fear response.